Hi, I hope you all had a great Christmas break. I am looking forward to working with you this spring. I wanted to make a quick introduction video to adult nursing NUR400. You should be getting the link hopefully on Friday, January 6th, or on Monday, the 9th. When you have access to the course, here's a couple of navigation information. Now, just know that this course is not completely set up right now, but once you get access to it, I've tried to put enough information there that you can get started if you're wanting to kind of get a jump start. But I want to caution you, I am a firm believer in mental well-being. I do not want you to spend the last week of your break completely stressed out because you're jumping into the coursework and becoming overwhelmed. If you do nothing but just kind of familiarize yourself with the course setup, and then come that first day of class, and we'll talk about any questions that you have. We'll go over the syllabus, and we will get started together. Spend time on your emotional, mental well-being, spend some time with your family next week, and then carve out a little bit of time just to take a look around and see how the course is set up so that you feel really good going into that first week. I know you're going to be really busy with a lot of credit hours in the spring, so it is going to be tempting to really jump in and dig into these courses. And that's okay, as long as it's not causing you undue stress. So let's take a quick look. You're not going to see a whole lot under grades, so don't worry about that right now. If you go into your assignments, you will see that I've set the course up kind of with units and modules. And then there's an exam and quizzes folder. And then here is your course map. And again, this is subject to change, just depending on, if by chance we do not get through, on January 18th, then that will be continued to the 23rd. I've tried to put all of the chapters in here that we'll be covering, but occasionally I might have missed one of these. So we'll update this as needed as we go through it, but this is something I would encourage you to print off, because I think it's very important to always have an idea of where you're at in the course. The exam dates are listed on here, as well as spring break. And then the other, before we jump down to these two items, let's go look at units and modules. So every time you start a unit, you're going to see a weekly assignment. And so it looks a Word document like this. And it'll always start up with kind of like what my objectives are for this module. So our first module in the first few weeks is going to be going over disorders related to neuromuscular system. And then it's going to tell you, what do you need to do prior to class to be prepared? And I do expect students do this prep before class. And I will tell you, if you don't, you're going to be lost. I do a flipped classroom with the understanding that students have at least done the prep before they come to class. So this sheet will tell you what my expectation is. So you'll see by Wednesday of week 1, I'm going to expect that you've reviewed these, this reading out of the ebook, and I've tried to put page numbers on there, that you've worked on these evolve lessons. And then you're going to see that there are concept maps, and sometimes there are diagnostic procedure templates that are required for completion. And so I've put those in red. And then you'll see in week 2, you'll see the same thing. What do I expect for you to read and review? What evolve lessons? And then what's required? Participate anytime it's required. At some point, it's going to count into your course grade. So that means that like maybe we'll do a quiz in class and I'll say, well, you can use your completed concept maps. And so if you've done a good job on your concept maps, that should help you be successful on that quiz. I may at the end of class say, turn in your seizure epilepsy concept map, and you'll turn that in and I'll grade that concept map. It is expected to be in class that you have anything in red ready to turn in or to use for any quizzes or any class activities. So pay close attention to any time it says complete for participation, because those are required. How I will start class. I like a lot of experiential active learning. So when we first start class every day, I'm going to say, how did your prep for class go? What questions do you have? And that is where I expect if there are any muddy points, any thing that was confusing in the reading, anything that you really feel kind of lost on, you to be brave, raise your hand and say, I'm not understanding this. And we'll go over that. If there are no questions, we will jump right into those experiential learning activities. I like to use a variety of learning activities. I'm hoping we can incorporate some simulations, whether they be simulations with a mannequin, simulations that are done virtually, escape rooms, hands-on activities, case studies, to where all of this information you were reading about, you're actually applying to a clinical kind of setting. So this I'll always provide to you at the beginning of each module. And usually I'll try to do it, like in week 3, I'll be posting the next learning modules sheet. So usually you'll get this and you'll have the information for a couple of weeks. That way you have time. You are welcome to work ahead on this if you like. So those in red, those assignments that we were talking about, this is guided note-taking here. Let's look at this concept map. So this is what a concept map looks like. You'll put here, you will put in that blank box at the very top, whatever that assigned disorder or concept is. You'll write a very brief explanation of pathophysiology. You can bullet it, you can write it in complete sentences. The beauty of concept maps is that all of you will have a concept map that looks unique, because I have a family member that has multiple family members that have diabetes. So if I had to fill out a concept map on diabetes, I would not have to have a lot of detail because I understand diabetes. I know a lot about the medications. I know a lot about the education, the treatment. So my concept map might be pretty brief on here. I do not have family members that have Crohn's disease. So if I was filling out this concept map for Crohn's disease, I'm really going to have to provide a more detailed explanation of the pathophysiology. When we go down to the assessment, that is, what are the assessment strategies that you learned about in your health assessment class that help you recognize important cues? What are some of the priority lab tests that you can anticipate being ordered? This next big box is, what are the complications of this disorder that we're trying to prevent or that you want to be constantly looking for to make sure that your patient's not declining? And then take action are the interventions that need to be done to promote health for our patient. So I've divided our take action box into what are specific things that nurses need to do. Maybe it's positioning with head of bed up. Maybe it has something to do with doing dressing changes or a very priority education point. And then interdisciplinary interventions. This is, if we have like a musculoskeletal disorder, maybe it's very important that we bring in physical therapy. They need information on exercises and how to, promote strength. Also under take action, and I put it right here parallel with nursing, is going to be priority meds. So you may put here in your nursing box that medication administration, but in this box, I would expect to see drug classes with maybe, an exemplar medication identified. You're welcome to put any side effects in here. And then this final box down here is priority education topics. Print these off one page. That way the back page is blank. And then on the back page, you can put any notes from class, any videos that you've watched that were helpful. If there is something like with CAS care, there is a lot of interventions that we need to do to make sure that there's not circulatory compromise. So you might want to bullet point those important CAS care recommendations on the back. So all of these will be one-sided, with the front side will look like this, and then the back side will be any additional notes that you have. I will be in an announcement, or I'll put them here in a file. I have some students that took this class last semester that are going to talk about their strategies for success. And so listen to those strategies about how they were successful on the coursework as well as the HESI examination. And then again, if you do readings in this class, you can go ahead and start working on these. And then the first day of class, we will go over any questions you have. You do not have to even touch these until that first day of class if you don't want to. But this is in those student videos that I'm going to provide you. You'll hear them talk about concept maps. So I wanted you to at least kind of see what that looks like. The other one that you'll see is, it's also kind of a concept map, but it's over. There are sometimes some diagnostic tests or surgical procedures that we'll want to concentrate on. And so this, you'll just put that name in here. Why, if it's a test, why is it indicated? And then what would a positive or negative result mean? If it's a surgical procedure, you may not have indications of findings. So you can just put an X through here or write NA. And then there's, again, additional notes. And again, you'll make these where the front page looks like this. And if you have notes you want to put on the back of the concept map, you can write any additional notes on the back. So I hope this is helpful for you, and I really look forward to working with you. I've heard lots of good things about your cohort as a whole and the excitement and motivation that you have. And that right there, being motivated, being excited, is the first steps to having a positive learning environment. So have a great week next week. And my name is Dr. Erica Blumenstock. You are welcome to contact me via email. If you have any questions, I may be a little bit delayed until that first week of class, but typically next week I'll try to respond within 24 to 48 hours. Have a great day.